Hi, everyone, and thank you very much for joining us today. My name is Savannah Sellers. I'm an anchor and correspondent with NBC News, and I am so lucky to be today joined by the director of the Centers for Disease Control and Prevention, Dr. Mandy Cohen. Thank you for being here.
Great to be here. Hi, everyone.
Please. Of course, we are all aware of sort of the unprecedented times. I know that's an overused word, but it has certainly felt that way over the last 4 years or so. And the CDC playing a huge piece of that, whether it's in the COVID pandemic, the work that you're doing right now to sort of rebuild the CDC, certainly rebuild trust in it, and we are going to dig into all of that. This is called Straight Talk.
Straight Talk.
So we'll get ready for some of that. The first thing that I do want to point out is that it's been just about a year, and just a couple weeks or so, I think, is your 1-year anniversary. Congratulations on that.
Thank you.
What has this year been like?
What a fantastic year. I feel really honored to be in this role at this time. Look, the world is different in 2024. We have learned so much about what we need to do to protect health and improve lives for our country and, frankly, for the world. And in order to meet that moment, CDC also needs to be different. So I was really honored to take on this role coming out of an emergency and thinking about how we can take those lessons learned, really embed it into our work, and make sure that we are the response agency that our country needs in order, again, to protect health and improve lives. And I'm really proud of the work. I've never gotten so many frequent flyer miles in my life. I've been all over the country, all over the world, seeing the incredible work. I'm really proud to lead the team at this moment. But look, folks are tired coming out of the pandemic. And so I'm really proud of how they've really embraced the change that we need to really think about in order, again, to turn this next new chapter. I think we are really focused on embedding those lessons learned. For example, turning our data into action really quickly. I think CDC does a great job of having a lot of data. I think we have work to do to make sure we can make that data super actionable, as well as communicate simple, common sense solutions for folks to protect their individual health, their family's health, their community's health. So I hope you're seeing how we're communicating differently, we're using our data differently, and we're investing differently in the core systems that we need. You may notice in the past we're very disease-oriented at CDC. We invest in malaria or HIV or COVID. But what we haven't been as good at doing is investing in the core functions that we need to make sure that we are the response agency, that we're protecting health, no matter the health threat. And so we're very focused in this next chapter of making sure that we've learned all of those lessons and embedded it in those core capabilities.
With trust at a pretty significant low, polling shows about a quarter of Americans, we'll get into this in a minute, but not trusting the CDC or the recommendations that they get from the CDC, and then of course just with a crisis like COVID, why did you want to take this job?
Well, it's hard when you get a particular phone call to say no. No. I was honored to take on this role. I was so lucky to be in a moment of leading North Carolina through the COVID pandemic. I work for, I think, the best governor in the country, Roy Cooper in North Carolina. He's about to finish his 8 years leading the state of North Carolina. My successor who took over for me, Cody Kinsley, is here, who's also amazing. We got very lucky to work for a great governor. And leading through that historic pandemic really taught me a lot about how to think about trust. And it was the governor who, in February of 2020, said to us, the way we're going to be able to successfully navigate through this pandemic is about trust, is like maintaining trust with the people of North Carolina. And we took that and turned it into a very tactical plan. And it was founded on 3 things. The first was on transparency. Being incredibly transparent with our data. Why were we making the hard decisions? Explaining to folks, this is what we know, this is what we don't know, and this is how we're making this decision today. Transparency was hugely important. I was very transparent about the decisions I was making for my own family. I talked about my family, my kids, a lot about how I wasn't seeing my extended family during the pandemic. The second was about relationships, and I was lucky that I got to lead in North Carolina for 3 years before the pandemic hit, and we had built a lot of strong relationships on both sides of the aisle, strong relationships between public health and health delivery. We got, I don't know if it's lucky, that's the wrong word, we had a lot of hurricanes in North Carolina. Anyone from North Carolina? Right, so we had some practice responding to emergencies and building up those partnerships and knowing how to work, but we also really thought intentionally about where are the already trusted members of the community. So North Carolina loves us some NASCAR, and we're a very faith-oriented state. And so how do you use those strengths, I think, of North Carolina and build that trust? So we had NASCAR drivers as well as church leaders and faith leaders working with us during the pandemic. And then the last one was really in operational excellence. And this is the thing you learn in kindergarten of like doing what you say you're going to do, right? Where if you say there are going to be tests available, make sure there are tests available. So it's not just recommending a vaccine, it's making sure that it is easy to get that vaccine and it is available, the cost is low, you can get the transportation. So those are the three main lessons really that came out for me about building trust in North Carolina. We very much mapped that to the work we're trying to do at the CDC. So I want to say, I know you started with the quote of saying 25% of folks don't trust the CDC, but 75% do, right? And so I'm going to take that. We want to build on it, of course. And, you know, there's a lot, I think, actually, of misnomer of saying, well, no one trusts the CDC anymore. Actually, the polling shows that we had, you know, there was a bit of a dip, but we've actually regained that trust in polling. And so we're actually back to pre-pandemic levels. And I think that's after a lot of hard work to show for folks that we are working for them. And how our work can help them in their real lives. So, for example, I'm really proud of a new heat health tool that we put out. It's real hot, not here right now, but everywhere else. It's super hot right now. And we put out a new tool to help folks understand not just what the temperature is, but what does that mean for my health? And what should my family think about? So do you have chronic disease and take particular medicines? Does your kid have asthma? What should you be thinking about in the heat, and how can you modify what you're doing in your everyday life to protect yourself and your family?
I most certainly want to spend most of our time talking about the work that you have done at the CDC, which was post-COVID. But you just made a point to say how important transparency is and how much of your leadership relied on transparency during that time. Do you think the CDC was transparent enough during COVID?
Well, I think it was really important for us to be able to articulate what we knew and what we didn't know. And that's really hard to watch science evolve in front of our eyes. We sort of all had never really been in that situation before. And I think there's a lot of folks who love to Monday morning quarterback a crisis, but it's a crisis. And like, look, we're not going to get everything perfect. I can only tell you how we thought about it in North Carolina around transparency, and that was having the governor, myself, and others literally every day doing a press conference and taking questions and explaining things to North Carolinians. So every day, 2 o'clock, Governor Cooper, myself, were out trying to, again, explain where we were, how we were making decisions, and that we would be back tomorrow if something changed. And so that and then we put data up on our website, one of the first states to be able to do that. And it took a ton of effort and a ton of work to be able to do that. But I think that really built a lot of trust with North Carolinians to say we were willing to go out. I think we did 180 press conferences. And so that kind of transparency, I think, really signaled to folks, one, that we were obviously taking it very seriously, but that we were willing to take hard questions every single day.
In the vein of transparency, and maybe for those 24% is the number from JAMA that say that they don't trust the CDC. I do totally. 76% do.
That's pretty good.
But maybe for those 24, maybe even for more people. In that vein of transparency, do you think that it is important to drill down on the origins of COVID?
Well, I think we need to be ready for health threats no matter where they come from. So whether it was lab-related or whether it was a transition from our animals and animal markets, the next one could be either, and so we better be ready for both, right? So, I'm more focused on making sure that we have the systems to be ready no matter what. And so we are very focused on our core capacities. Do we have the data, lab, workforce, and the response capability to be able to really respond, right? So no matter where that threat comes from, it may be here in our backyard, and I'm sure we'll get into avian flu, which we're seeing a lot here in the United States, or it may be overseas, which is why CDC has 60 country offices all around the world, and we're investing globally because the most effective way to stop an outbreak is at its source, right? And so having the expertise that we are building in partnership with many countries around the world, I think is really important. And we need to be ready no matter where that threat comes from, and it may be an infectious disease or it may be heat-related. Heat, as you know, are having many impacts on the environment, but it's also changing the patterns of mosquitoes and ticks that carry other diseases. So we are need to be ready for all of the threats that are coming our way.
But if I may, on the origin of COVID, for example, for many people, they feel that what they were hearing was then relegated to some conspiracy theory in terms of a lab leak. And now it's kind of half and half, how people believe that it actually may have started, that being one of the leading theories. Do you think that something like that was a piece of the mistrust, that there was that back and forth on something as important as that to a lot of people? How did this happen to us?
Well, I think folks want straight talk, right, which is what we're doing today. I think folks want to understand that we are investigating to the best of our understanding and then taking action on that. And I think that's, from my seat at CDC, what we're trying to do and explain to folks about how are we investing to protect their health and give them simple, common sense tools that can help them and their family be healthy. I think health sometimes can be politically divided, but when I have every conversation, health itself, I think is very unifying. I haven't met one family that doesn't want their family to be healthy. Now, we might have different ways of getting there, and I think that's really okay to have that discussion of how we get to that health, but stick with that alignment. And that's where I think CDC really can thrive, because we bring data and evidence and an investment to allow us to get closer to health, right? Well, our entire mission is to try to make sure that our country is as healthy as possible, and that health allows us to be economically successful as well. And so helping folks understand that connection, the same way we invest in our military to protect us and keep us safe, we need to invest in CDC and our core capabilities to keep us safe. And so when I talk to folks about what they want and what they need, that resonates a lot with folks.
How has the balance been of the work of preventing disease, preparing us for the next crisis, along with trying to get that trust back up in? What's it been like to balance those two challenges?
Well, it's so interesting. When public health is really successful, it's invisible. And what we need to make sure folks understand is that when we're successful, we are protecting health all the time. So I often share, you may have heard that we had our first domestic cases of malaria, the first in 20 years. CDC was actually founded to get rid of malaria here in the United States, and good news, it hasn't been here. We saw our first few cases in Florida. So I was sharing with a member of Congress, and I said, you may have heard we had to close Disney World. And they're like, what? Oh, I was like, oh, no. Actually, we didn't have to close Disney World because we responded to the malaria cases in Florida. We jumped on it quickly, both Florida and the CDC. We used our expertise from overseas, where we've been working on malaria, continue to work on malaria, and we were able to extinguish that outbreak very quickly, and it didn't impact Florida. And so everyone got to enjoy Disney World last summer. You're welcome, public health, right? So thank you, public health. But we need to tell those stories, right? When it works, it's invisible, right? So everyone who enjoyed Disneyland last summer doesn't realize that public health allowed that to happen. Or it's the safe meal that you had at a restaurant, or the safe water that you're drinking, right? So we have to all be better at telling those stories. I think there are ways in which we're doing it. I want to acknowledge the CDC Foundation that is helping us do more of that. But this is also where I also have a session tomorrow where we're going to be talking about how the business community really needs to think about how public health can help them. I think we all learned how a little virus can turn our lives upside down and businesses upside down. And how do we make keeping our communities safe and healthy part of what it means to run a strong and healthy business. So tomorrow, 11:40, come see us. I'll be with Representative Larry Bouchon, and we'll have a really good discussion. Again, where are those bipartisan places where there's a lot of alignment on how we protect our communities?
You mentioned in that example partnerships globally. You also mentioned the frequent flyer miles you've been racking up. I know a lot of this year you have spent overseas working on partnerships. How much is that global conversation relationship impacting the work that you do here? How does it impact us here at home?
So very similar to us needing to invest in core capabilities here domestically, we need to do the same thing internationally when we're working. So often, again, this is when we have been funding things globally, it's been to tackle a particular disease, which is good. And that has been a lot of work. I want the PEPFAR work to impact our HIV crisis around the world is unbelievably successful, just historic in terms of its ability to transform what was happening around the world in terms of death and disease and where we are now. It's just incredible. But we've built a platform that now can be used for other diseases and threats that we may see in the future. And we already saw that work during COVID. We used a lot of what we built for HIV to pivot to COVID. And so I think that's where we want to be going in the future. I was in Cambodia earlier this year, and I went there specifically because they had 4 deaths from avian flu in Cambodia, all from poultry exposure. But what I got to see there was the incredible infrastructure that CDC has supported over 20 years of partnership. These are deep, trust-building partnerships over decades of work, where I went from seeing a busy bird market, talking about where did health threats come from. I went to a busy bird market where our teams were swabbing chickens and ducks, immediately sequencing the viruses that they found there to understand, are we seeing any changes in the viruses that these birds were carrying? Then I was able to go straight to our lab where we're processing that, and where when someone came down with avian flu, within 7 hours, they were able to understand what the diagnosis was and if there were genetic changes. And then we were at the hospital that was supporting the work and getting to see the investment we made there and how the care for the patients went. And then lastly, we're investing in the workforce of public health, where we were training the folks who went out and did all the contact tracing. So what other exposures did that person have? So it just shows the totality of what we have been doing at CDC and investing. It's keeping us safe, right? I'm watching in the bird market with swabbing those birds and chickens, keeping us safe at home. Because if we find something in Cambodia, we want to stop it in Cambodia. Now, we have some avian flu here at home we got to work on, I'm sure we'll get into, right? But that's how our global work protects us at home. It's actually the most cost-effective way to protect us at home, is to make sure that we're working globally to stop outbreaks at their source.
We will certainly get into avian flu in just a moment. On the international piece, though, straight talk.
Straight talk. Let's do it.
How much of time spent in those conversations is reputational repair, if any, given the fall in trust we saw here at home?
Globally, none. I will say globally, the work that the CDC does, the expertise that we bring is universally, truly lauded. I don't think I appreciated this as before I came to CDC. Just the deep gratitude, because this isn't where we show up at the last minute when there's an emergency. This is about, like I said, 20 years plus, maybe more, of partnership building and investing alongside. And I think CDC does this in such an incredible way, which is, it's really about teaching folks to fish, right? It's not just giving fish. And it's building that infrastructure, building capacity, doing training. We have trained so many epidemiologists on the continent of Africa. It's really inspiring. We're training lab technicians to make sure they have the lab capacity. So I think it's really inspiring. And so actually none of the conversations globally are about, if anything, they want to make sure that we are in good standing, because we know that, look, our domestic success and our global work are linked. And so I do spend a lot of my time domestically to make sure that we show our value here at home every single day, so that we can continue that work globally.
Let's talk more about avian flu. Just first, is this one of the biggest challenges you've been presented with so far?
So I would have said, if you had asked me 6 months ago, what is the top bug that I'm worried about and that keeps me up at night, I would have said avian flu. And here we are. Now we have a pretty large outbreak in dairy cattle for the first time. So it's still at the top of the list. But this is, I want to distinguish where we are very in a different place than we were for COVID. You know, COVID, it was novel. We didn't have a test. We didn't have a vaccine. We certainly didn't have any treatment. And we didn't know about this virus. Very different story with avian. We've been studying this for decades. And so we have a very extensive network of detection mechanisms that we're able to rely upon. So right now, we can get real-time information from 90% of the emergency rooms in the country to know what's going on, de-identified, right? So you protect privacy, but it gives us that visibility. We can now get laboratory data from big commercial labs to really understand, is there going to be difference in ordering? We have a wastewater infrastructure that is now was built for COVID, now is being used for Mpox. Plus, we've been studying this, and we have tests, we have treatment, and we have vaccine candidates. So we're in a very different place. But with all of that being said, it doesn't mean that we are not taking this incredibly seriously, and making sure we're understanding one very important thing: is this virus changing? The good news is we've never seen human-to-human transmission of this virus here in the United States. Great news. But we also learned through COVID that can change. So today, Friday, we've never had a human-to-human case. Could that change tomorrow? Yes, it could. Now, I do think that overall risk to the population continues to be low, but that's why we need to stay ahead of this virus. You don't want to give it opportunities to change. So you really do want to cut down the amount of virus that we're seeing in our cattle, in mammals, and any opportunity for it to go to particularly other kinds of animals like pigs. Pigs we're particularly worried about because those are places where we know we can get more genetic transformation of the virus. So we want to make sure we're cutting down on the amount of chances for this virus to change, and we want to make sure we're protecting workers who may be exposed to infected cows. We do know that this virus can spread through contact. We've been lucky that we've had 3 pretty minor cases so far. I feel very confident in our detection mechanisms that I don't think we're missing any severe cases of avian flu, given the extensiveness of our systems. But we have more work to do, again, to make sure that farmers are protected, that we're doing enough testing on our farms. But the other good news I didn't mention also, milk is safe, right? My kids are drinking milk. Pasteurization works. But we want to, again, cut down on the amount of virus circulating so it gives it less chance to change.
Oh, I have to ask about that since you just said it. Are you concerned about what you're seeing in the rise of people drinking raw milk?
Well, you know, it was never a recommendation from CDC to drink raw milk before this. So please don't drink raw milk. That is not a good idea. We have had multiple studies that have shown in animals that folks ingesting raw milk could make you very, very ill. Please don't do that. And I think this is, again, it goes back to how do you get to places where people are consuming their information, not their milk, but their information, and partner to make sure that we're piercing into different communication bubbles that we know are out there. So we're trying to get out good information in lots of different ways, but please, raw milk is not something we recommend.
I want to drill down more on social media in a minute, because certain corners of TikTok says the opposite, to your point, which is, but before we move on from avian flu, one question. I think the word, I don't know if new strain gives anybody else PTSD from COVID, when it was like, oh, we have this one under control, now we don't.
Yeah.
Correct me if I'm wrong, but we are seeing some evolution of this, not here, right? But there has been some concern, like in Mexico, for example, about how we've seen this. And do you think that could be on the horizon?
Well, so far, I want to reassure that we've done very deep characterization of the different strains of avian that we've seen. There was a different type of avian that we saw in Mexico just a few weeks ago. Cambodian strain, what we're seeing now in dairy cows. From our look at this virus, what is important is that it hasn't changed in a way that makes us think it's more likely to spread human to human. Those receptors, those binding sites have stayed exactly the same. So those are the things that we're watching out. Now, there have been other changes within the genetic pattern of it, but not in places that make our team concerned. But this is exactly why we need to stay ahead of this and make sure that we are preventing or limiting the opportunities for it to spread, to change. And so that's why we're trying to get our arms around it.
What do you do about the just total tsunami of misinformation?
This is a hard one. CDC is not going to solve this by ourselves. My thought and our tactical approach to misinformation is to flood the zone with good information, right? So make sure we are getting out accurate, timely, easy to understand information that people can use, right? Common sense, simple solutions. But look, everyone is consuming their information differently. And like I said, the world is different in 2024, and we, CDC, have to be different. So we have to actually make our information much more engaging. Some would say entertaining. And I hope you see that we're trying to do that. We may play on a little Bridgerton theme or a thing like that, so to make it a little more relevant. So we're getting there. I think we have more work to do, but I think this is where partnership is really important. I think that there are folks who are really good at this. We want to partner with folks who are good at making sure we can make good, accurate, timely information also engaging for folks so that it works. So we have more work to do there, but that is my approach within the CDC lane of misinformation. Now, there's things to do in the larger world of Congress and regulations and others, but for us, it's about good information and flooding the zone and really figuring out how we can use those same algorithms that can promote wrong information. Well, how do you use them to promote the good information as much as you can?
I did see the Bridgerton thing.
Oh, thank you.
Just so you guys know, I will open this up in 10 minutes or so for audience questions, so start thinking about those if anyone has one. How concerned are you about what you're seeing in people's comfort level or the lack now of vaccines? Obviously, just what happened generally with the COVID vaccine, but now I've heard you kind of be concerned prior about what we've seen happen with measles. Generally, how do you think we're doing in that regard?
So I want to start with the good news, which is we continue to see very, very high rates of vaccination for our kids for the routine vaccinations, things like measles and polio. We continue nationally to have rates 92, 93, 94% of our kids being vaccinated, and that is good news. However, there are still pockets of communities in the country where folks are seeing lower rates of vaccination, and that is not surprising. We've seen a few cases of polio pop up in upstate New York. We've seen a couple of more measles cases. Measles, as you know, is the most catchy, transmissible disease, so it's often the first thing we see. So we've seen more measles, but generally doing very well with routine vaccines. And when we ask folks about their trust in those vaccines, actually, we have not seen changes related to that. different from flu, COVID, some of the more annual or other vaccines that kind of sit outside of those routine vaccines. And I think we have work to do there. Trying to help folks understand why, again, going back to these core things, why does this matter? What would I recommend for my own family? And to help folks understand how to make good choices for folks, but also make it easier for folks to make those choices. So, for families to get their kids a flu shot and a COVID shot this fall, how do we make it as easy as possible to get your kids vaccinated? One of the things you'll hear from me tomorrow as we talk about what businesses can do, right, is I know many of them brought flu clinics to give flu shots right on site. Love that. Please offer the COVID vaccine as well. So COVID and flu vaccine. The risks are very, very similar now that we are in a different place with COVID, but we need to keep up our protection against COVID as well. I hope you've seen that we've really streamlined our COVID guidance, and it's really focused on vaccination. Vaccination is really what is going to save lives as we go forward, so that continues to be our top recommendation.
Do you think most Americans realize that the recommendation is that they should continue to get the COVID vaccine?
Well, we're hoping so, and if I can have our help of the folks in here to continue to get that message out. I hope you're seeing that we're trying to simplify our guidance. We're not in an emergency, which is good, but the risk is still there, and vaccines are the best way that folks can protect themselves, particularly if you're over 65. So you will see us do a lot of messaging and a lot of focus towards folks who are over 65. We do a lot of focused work with our clinicians, right? Trusted, your doctor, nurses in your community, pharmacists, to make sure they have all the information they need to answer questions about the COVID vaccine, the flu vaccine. But again, so that building that trust with other trusted messengers is where we're focused.
Avian flu aside, anything on the horizon that's concerning to you?
Well, that's our job, is to be worried so you don't have to be. And again, we're really focused on investing in core capabilities. And we have 3 top priorities. One is being ready to respond to any health threat, so you can know we're doing that. Second is improving mental health. And the third is supporting young families. And in terms of the threats, avian is certainly one I spend a lot of my time on. But look, heat is also a threat. And so that, again, why we have a new heat risk tool that I hope you all take a look at with some additional guidance that we put out. But we're also losing 100,000 people to overdose every year, 50,000 to suicide. We have to do better, and we can. And I think we're making some progress. We saw for the first time in a few years starting to go down on our overdose deaths. That's why it's our second priority, improving mental health, reducing suicides, reducing overdoses. But we have more work to do. So that is a health threat. We are losing people way too early. And so we have work to do in that space, but that, again, is where CDC is offering our data and our expertise and helping folks understand what are the best practices that they can invest in for their community to keep them safe.
And I think it says something that the Centers for Disease Control is taking up mental health as such a priority.
Well, look, we know mental health is a disease. We also know addiction is a disease, not a moral failing. And so we need to be making sure we're arming people with the resources and tools to protect themselves, making sure we're promoting things like 988, 24 hours, 7 days a week, a resource for folks. If they're in a moment of crisis, reach out. For folks who are struggling with addiction, know recovery is possible. We know the best time to get folks into recovery is when they have a non-fatal overdose. And so how do we make systems work so we can link folks to care at that moment? That's data straight from CDC. So those are the kinds of places where I think we can make progress.
I'll just ask one more question before we open it up to the audience. 6 or 7 months or so before you took this job, a group of policy experts, medical experts came together to kind of say the CDC needs an overhaul pretty publicly. Would you say that's what you've been doing? Is that what the last year has been, an overhaul?
I would say it's a really important moment for change, and we've undergone a lot of change. There's been some, organizational structure change, but for me, more importantly, is operating differently as a team, as that one team that, again, is not disease siloed, but is disease agnostic, focuses on really core systems, data systems, laboratory systems, workforce training, response capability, and making sure we're doing that not just domestically, but globally as well. So we have gone through a lot of changes, and we're not done, right? So this is, hard work that's going to go on for a number of years, and we should always be searching for improvement and making sure we're getting our organization to be operating even better. But yes, we've gone through a lot of changes. I'm proud of the team. There's more work to do.
Absolutely, and congrats again on almost 1 year. Okay, I'll open it up to audience questions. We got mics moving around the room. I see a hand right here.
Thank you so much for what you're doing.
Thanks.
Thank you so much for what you're doing. Forgive me for asking this question, please, but what's the CDC position about masks?
So turns out masks work to protect both you and others. And they are one tool amongst many that folks can utilize to protect themselves. You were hearing me say we simplified our guidance around COVID to really focus folks on the thing that is going to save the most lives, and that continues to be vaccine. Now, for certain folks, you want to layer on additional protection. Masks is one. One thing that we don't talk as much about that I wish we would talk more about is about indoor air quality. And making sure that we are thinking about not just opening a window, but as we think about our schools and our airports, are we doing the work that we need to improve indoor air quality? We have some recommendations there as well. So there are many layers of things we can add on to protect ourselves. Again, it's not just about COVID, it's about COVID, flu, RSV. There's lots of bugs, parainfluenza that circulate, particularly during winter, that we need to think about. When someone asks, well, what do you do or what should I do? You want to think about your own personal risk as well as who are you around. Are you going to visit the grandparents? Yeah, maybe you want to add on some additional layers of protection for yourself. If you're young and healthy, maybe less is more for you. So again, who are you? What is your risk? And who are you around? And what is their risk as well?
We'll go right over here.
Yeah. So you talk a lot about the infectious diseases, and they sort of occupy attention and your attention as they should. But what most people die of is not from those diseases. They die of non-communicable diseases.
Heart disease.
So heart disease and cancer, obesity, diabetes. So what is the CDC's initiative, and where are these diseases in your priority?
Yeah. So you heard response number one, right? Because we have to be ready for whatever health threat, and that allows us to invest in core capabilities that help us no matter the threat, whether it's an infectious disease or not. Second is in improving mental health. Again, making sure we're reducing suicides and overdoses, really important area. And then the third is supporting young families. And this is really where I see our prevention investments really shine. Because yes, it's about making sure our kids are vaccinated, as we were talking about, that they're not food insecure, that mom's having a healthy pregnancy. But it's also so mom and dad are going to live long, healthy lives and are role modeling those healthy behaviors for our kids. And so this is where the diabetes prevention work, the obesity, smoking cessation work really shines. And helping folks understand why it's so important for CDC to continue to work on these issues. We know that there is a link between infectious disease and our chronic diseases, right? We did less well in COVID as a country because we were underlying a sicker country, right? We had more chronic diseases. And so there is that important link. Plus, we all know we want our systems to be as proactive as possible, not just a reactive system. And right, CDC can bring that expertise and the data to understand how do we think about investing in a smart way around prevention.
We'll go right here.
Hi, yes.
Hi.
My question is, why isn't the CDC able to study the epidemic of gun violence?
So we actually we have some parameters from Congress around what we're able to use our dollars for in terms of evidence, but we are able to actually do work in the space of gun violence, and actually you'll see some more from CDC later this year on that, particularly looking at the impacts of guns on suicide. And I think that's where we've done the most work. As you probably know, that half of suicides are related to gun violence, and if you're looking at male suicides, it's even higher. I think there is a lot of building consensus around how do we do better related to gun safety in that space. So I think that is one place where CDC is able to bring our data and expertise.
Oh, we'll go right there.
Thanks. Yeah, back to infectious diseases, if you will. You mentioned that there is a difference between people's trust in routine vaccination and some of these annual vaccinations. How do we, with all the innovation happening in potentially annual vaccinations like RSV, how do we make people believe more in these being routine vaccinations as opposed to thinking of them as periodic?
Yeah, I think it's a good question, but also remember, like, in order to build trust, it takes time. Right, these routine vaccines have been around for many, 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 many years, and we've had a long time for folks to build trust. Now, I want to accelerate that. I'm not willing to wait 20 years to save lives. And so we're looking for ways, again, to build partnerships to think about what are the ways we can help folks understand that. But this is where I think the partnership between public health and the health delivery system is so critical. Right? Folks aren't coming to public health to get their vaccines. They're going to their pediatrician's office. They're going to their primary care doctor's office. And are we making it as easy for those folks to answer questions about vaccines, frankly, to have vaccines available for their patients? We showed in research the number one reason people aren't getting vaccinated is because their doctor didn't mention it.
Wrong.
So they just assumed, my doctor didn't mention it. If he or she wanted me to get it, they would have mentioned it, and I would get it. But they didn't mention it. And the doctors are like, I don't want to mention it because maybe that feels political. And you're like, no, it's medical, right? This is about health. And so, help. So one of the things CDC did last season was put out a discussion guide. How do you talk about these vaccines with your patients? How do you make sure that you are bringing it up, putting it into your workflow of your practice? And this has been a great partnership with AMA, American Academy of Family Physicians, American Academy of Pediatricians. So it's more than just saying you should get it. It's how do we put it into the workflow, make it easy, and to your point, make it routine. You come in the fall and say, hey, it's September, it's October. Have you gotten your flu shot? Have you gotten your COVID shot? What about RSV? What are your risk factors there? So I think we're going to get better and better at this, but this is exactly why public health and healthcare need to be integrated, why we have to have the data integration that's absolutely necessary so we can know who's vaccinated, who's not vaccinated, and making sure we have quality metrics around it, that we're using our payment systems to incentivize vaccinations. There's a lot more I think you're going to see us continue to get better at as we go forward.
Let's go right here.
Thank you for your talk, Dr. Cohen. This is great. I'm really interested in molecular and genomic epidemiology, such as wastewater that you mentioned. So I just want to hear your opinion. Where is this going? How are we going to expand this to infectious and even non-infectious diseases? And then how can we change this to, instead of just say, this is what we're seeing going on, to tell clinicians, this is how you should alter your practice in the clinic based on what we're seeing?
I'm a huge fan of wastewater, and I know Niall Brennan. Niall Brennan's right here in the room. So he was chief data officer at CMS and came with me to CDC, again, to put our healthcare delivery data and public health and plug public health into our health delivery system. And he is one that really energized some of our wastewater work to make it more usable for folks. To your point, I'm a big fan of wastewater, but it's not a definitive. It's a signal. It's not a definitive declaration of something that's happening in a community, but it can be a signal that helps you ask more questions and focus your resources. We're seeing that happen in avian flu right now. We built this national network for COVID. We also started using it for Mpox, and now we're using it for avian. And so we are seeing different counties that are showing some impact of avian. But look, that could be for a lot of reasons. Is it from dairy cow? Is it from wild birds? Is it from chickens? Is it part of seasonal influenza A? So it's a signal. But I think it helps us target our work, and I want to see us get more and more sophisticated as we do that. I think there are a lot of possibilities here that we're just at the beginning of, but this is where I'm hopeful to see more innovation in this space. I think it's really exciting and can be a tool to give us an early warning signal before someone gets sick and walks into an emergency room. Yeah.
Let's go right here.
So the question was, what's CDC's role regarding long COVID? So obviously, we have learned a lot about the impact of viruses, and frankly, we're learning so much about what we don't know in terms of our own immune systems. Why do some people get so sick and other people aren't impacted as well? Why do some people have a 1-week course and others have months and months and months of ongoing persistent symptoms? We've made a huge investment across HHS related to long COVID. A lot of that is basic research that's being done by NIH. Dr. Rachel Levine, who is here, is leading that work for the department out of the office of the secretary, because it is important that we do it, not just from CDC, but across. The most important thing I want to continue to reiterate is getting vaccinated. Vaccination reduces your likelihood that you are going to get long COVID. So those are the important links we're trying to make for folks. But I'll just say, on a personal note, one of my very, very close friends has long COVID, is still struggling with long COVID, and it impacts many aspects of her life. So I see it personally. So it's something that's very much on our mind.
Let's go right there, please.
Thank you for being here. I have a question on the infrastructure regarding the preparation you're going to have for influenza season as it comes up in the fall. And with the avian flu in our stockpile, or our national stockpile, to create the vaccines, how are you making those decisions with, if we do see human to human, which is unlikely, but if we did see it, how would that impact our stockpile and readiness for our typical flu season that comes this fall?
Yeah. Great question. Good news is that manufacturing is complete for our seasonal flu vaccine already. And so if we needed to do any sort of emergency pivot to scale up to that kind of manufacturing right now, that would not impact this seasonal flu. We do already have vaccine that's been in our stockpile for avian flu that we've been working to make sure is ready to go if we would need it. The first place we would likely go is a vaccine campaign for farm workers, right? The people who have direct exposure, maybe for some of the healthcare workers treating them. But thinking about, we want to be ready, right? We've learned a lot of lessons from COVID. We want to be ready. So you're going to continue to see investments from us to make sure that we not only have the candidates, but we have the ability to scale up extremely quickly. And we want to do it with an mRNA platform, which allows for faster manufacturing. So I continue to say risk is low, but we are working hard behind the scenes to make sure that we continue to be ready. But to be ready requires investment. And it's not inexpensive to do this, right? To make sure we have the right vaccine. Remember, we want to also have a vaccine that is matched as closely as possible to whatever strain it is that might infect more humans. And so we will have something that is ready for what we see right now, but what we're worried about is the change, right? And then you need the vaccine to then map to that, and then that means additional dollars, additional manufacturing. And so I just want to keep reiterating the importance of investing in preparation. And again, when public health works, it's invisible, and it's really hard to convince folks to make that investment when we're not seeing the emergency. But I hope we can all try to have better conversations about how we can invest now to prepare us for the future. So that's what we're trying to do.
let's go right here, probably our last one.
Thank you so much for your compelling talk. And as a Canadian, I can thank you for being a trusted source of information. So you do have reach beyond your borders. As climate change becomes more prominent, I wonder if you can speak to the role that you see CDC having.
Yep. Well, first I want to say my Canadian counterpart is also fantastic, and you have quite a strong public health system there as well, and we learn from each other. On climate change, there's a ton that is impacting us in different ways related to health. Heat is just one of them, and understanding what does heat mean for us and our health. But I was alluding to before, right, that the heat is changing patterns of animals. It's changing patterns of mosquitoes and ticks. Obviously, we're seeing so much more avian now. We're trying to understand what is that related to some environmental changes, let alone the wildfires that are happening, don't get me started on the melting of the ice and whatever is coming out of the permafrost that keeps me up at night. So there's a lot that I think CDC has to play here in terms of understanding the patterns of changes in infectious disease because of this, but also the heat impacts. So we're trying to make sure we are ready for whatever the health threat is. So when we invest in data and lab and workforce, we can be ready no matter what threat comes at us, whether it's wildfires or new mosquito-borne illnesses. So, but again, the importance of that investment, that preparation, we're only as good as what we prepare for. When you go into a crisis, you want to be as prepared as possible, and frankly, we're going to try to stop the crises with the preparation. So, again, that's what we're focused on, making sure we have the right investment, and that can't be in CDC alone or in public health alone. Just to end on a note of partnership here, this has to be investment in the health delivery system. It has to be an investment in our schools. We were mentioning, clean, indoor air quality, right? There's a school partnership there. There's a business partnership. I'm plugging our session for tomorrow again, right? So this is going to take all of us. There are a lot of changes, a lot of health threats. We want to be safe. I see alignment around that, but we all want to be prepared together.
Dr. Mandy Cohen, thank you for this great talk. We appreciate it.
Thanks everybody.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.